How to navigate the U.S. healthcare system as an immigrant. Healthcare can be confusing for immigrants because there isn't a single form of health insurance in the United States. Instead, the U.S. healthcare system is a combination of publicly and privately funded programs with different requirements and rules for eligibility depending on factors like where you live, your immigration status, and your income. Here's what you need to know about U.S. healthcare as an immigrant. Why you want healthcare as an immigrant. No one plans to get sick or hurt, but unfortunately, it can happen to anyone, and when it does, it pays to be insured. Think of health insurance as a contract between you and the insurance company. When you buy a plan, the company agrees to pay part of your medical costs. Health insurance helps cover the cost of care like emergency room visits, medicine, and regular checkups with your doctor, so you and your family can stay in good health. An overview of healthcare options for immigrants. Many people in the U.S. have health insurance through their employer, but not all employers offer insurance plans. Some insurance plans will not cover everything you and your family need or can afford. That's why some people enroll in public programs like Medicare or Medicaid, or they shop for private insurance plans. Lawfully present immigrants are eligible for healthcare coverage through the Health Insurance Marketplace, a service operated by the federal government that helps people shop for and enroll in health insurance. And if you don't have eligible immigration status, you may still qualify for limited emergency services through Medicaid, depending on your state. Undocumented immigrants are not eligible for Medicaid or Marketplace coverage. Publicly funded insurance programs. Lawfully present immigrants are generally eligible for two government-funded programs, Medicaid and Children's Health Insurance Program, CHIP. Medicaid. Medicaid coverage can vary depending on where you live. It might be called something different like Medi-Cal in California or Apple Health in Washington, and the services may vary from state to state. Medicaid covers services like inpatient and outpatient hospital visits, physician services, and laboratory and x-ray services. The income levels vary by state, but even if you don't qualify based on income, you may be eligible for state programs based on factors like family status and disability. CHIP. For families who earn too much money to qualify for Medicaid, CHIP provides low-cost coverage for children. Like Medicaid, CHIP is administered at the state level, so eligibility and coverage will vary depending on where you live. But every state offers CHIP benefits, which covers services like routine checkups, immunizations, prescriptions, and emergency services. You can apply for and enroll in Medicaid and CHIP at any time of the year. If you qualify, your coverage starts immediately. The best way to find out if you qualify is to fill out a Marketplace application. If you or someone in your household qualifies, you'll be contacted by your state agency about enrollment. Some states require a 5-year waiting period for some lawfully present immigrants. That means you must maintain your qualified status for 5 years before you can enroll in Medicaid and CHIP. However, you may still be eligible for emergency Medicaid or other insurance programs available on the Marketplace. Private insurance programs. Private health insurance is any form of coverage that's offered by a company rather than the state or federal government. Just because an insurance plan isn't government funded doesn't mean it's any less affordable. Depending on your income, you may be eligible for subsidies that make some private plans cheaper. You may also be eligible for state-approved private health insurance plans. You can find private health insurance on the Marketplace. If you found this video helpful, please be sure to give it a thumbs up and subscribe to Boundless on YouTube. Thanks for watching.